Alrighty, hello everybody. WISCAP just reached out and asked if this is something we'd be interested in, and so I wasn't quite sure if it was finance and HR, but it sounds like finance met last week, and this may be some of these agenda items may be a repeat if you attended that meeting. But I thought we'd just introduce who's all on this, if that makes sense. And Cassie, you can kind of see who's here, but I'll start. I'm Jessica Rudiger, and I'm at WISCAP. And I'm the HR manager here.
I'm Pam Glenn at North Central Cap. Don't know why my picture doesn't show up. I'm not good at this.
Pam, go to the bottom left of your screen, and where there's a little camera, it says start video. Click on that.
Okay. It says Zoom is unable to detect the camera.
Oh, so you don't have a webcam for your computer then?
I must not. Nope. Makes sense.
I'm Deb Barleman. I'm the Deputy CEO and Vice President of Operations with NewCap, and I too have a little black square.
I'm Debbie Sheldon with Community Action of Rock and Walworth Counties. I'm the Finance and HR Director.
I'm Courtney Messer from Cooley Cap. I am the HR Manager.
I'm Anna Cardarella from Western Dairyland. I'm the CEO.
Rich Rasmussen from CAP Services in Stevens Point, HR Director.
I'm Lisa Smith, Finance Director for WISCAP.
I'm Candy LeCount, HR Director for NewCap.
I'm Diana Austin. I'm the Director of Operations for WISCAP.
Hi, I'm Kathy Wellington. Forgot my camera at home. And I am actually a planning coordinator for Southwest Cap, but I am June 1st moving over into finance and will become a payroll and benefits specialist. Yay!
Hi, I'm Pam Johnson, the Director of HR at SDC.
Hi, Miko Gill, HR Supervisor here at SDC.
I think that's everyone on the list.
Okay, thanks, Cassidy.
Yep.
Did everyone get a chance to look at the agenda? And was there anything you guys would like in addition to talk about? Okay, otherwise I thought what we could do is start out by just general agency updates, if that's okay with all. In particular, to talk about our current COVID operation and safety procedures that we have in place, and just in general, and maybe just highlight your procedures. And then I just tossed out kind of status of any recruitment activity and how that's going for all our agencies. But certainly add anything else you'd like to update everyone on as well.
So, this is Deb Barleman with NewCap.
Okay.
Like everyone else, our agency has been closed since the middle of March. Right now, we have a tentative return date of June 15th. However, cases in Brown County, where one of our offices are located, increased dramatically yesterday, and we've decided we're not going to open until the cases have gone down for 2 weeks. So we probably are looking at not opening the offices back up until the end of June. Our community health clinics remain open by appointment only. Anybody that enters the building has to have their temperature taken before they can come in, and everybody wears PPE. Our pantries are open their regular hours, but we are doing a no contact delivery for the food. When we return, we've already got a capacity building plan in place for when we return. We will mandate that all staff, if they are not social distanced by 6 feet from someone that they are talking to or around, they will have to wear masks. They will be required. We have taken care of getting masks for all staff, actually 3 of them, 3 of the cloth masks for all staff. And as I said, they do have to wear them. All desks that either aren't in their own office or didn't already have a cubicle around them now do have cubicles around them, again, to protect them, the staff themselves, as well as any clients that might come in. Let's see, trying to think of what else. I guess that's it in general, what we've done and what our plans are.
How about your weatherization program?
Weatherization guys have been, they are home getting paid.
Yeah.
However, we are also doing some updates on our buildings. Like we just finished painting the outside of our El Canto building. We are doing some construction work in a conference room that we have in our building in Green Bay. So those guys are coming in and doing that.
Okay.
Just trying to keep them as busy as possible, doing any maintenance type work, lawn work, anything that we can that we would normally pay someone to do it on the outside of the organization.
Sure. Are they looking at going into production then end of June?
Probably, yeah.
Okay. Okay. Thank you.
Yeah.
Oh, how about recruitment?
Candy, you want to take that question?
Sure. We continue to hire. We have put on approximately 7 staff since we've been out of the office. We are doing that all virtually, which has been a little challenge for us, but it's working well. Doing a lot of Zoom or team type of contacts that way. We do have 3 more positions yet to fill. And so we are continuing on that recruiting path.
Have you had good luck with applications and such during this time?
Yes,
okay.
Very much so at this time. Quite a few applicants, not all obviously viable, but plenty of people that we can interview and job offers that we have been made to the connecting people.
Okay.
Yeah.
Thank you, Candy.
You're welcome.
Anna, do you want to talk about Western Dairyland?
Sure, I'll talk for a minute. So we have, staff have all been working remotely. We did start a soft opening for Independence office on Tuesday in Trempealeau County, mostly for finance staff like others. We have a screening procedure and policy. We are making staff sign the policy, agreeing not to come to work sick, agreeing that, if they're in common areas, they have to wear masks. We will provide masks or they can wear their own, and then temperature screenings. We are not opening the Eau Claire office yet, as we are still under a safer at home order in Eau Claire that's been extended now to June 11th. And we are making some building changes to make it safer. We are also recruiting and hiring for a CFO right now. So it's ridiculous. So we had a kind of a Zoom interview with, board members and our interim CFO through Clifton Larson Allen and myself the other day. So yeah, it's a lot. And then, all of this rental assistance money, it's just, it's unbelievable. I have I guess there'll be time for questions, but my biggest concern is, how we take care of our vulnerable staff, making sure that they self-identify. And I guess if they don't self-identify and something happens, what are legal, what happens? So.
Yeah, I think I got that on the agenda.
I think you do, but that's just what I'm thinking about, so.
Yeah.
All right, but nice to see everybody. I know because I went for a walk at lunch, and so I was eating quick, and so that's why I stopped the video, because I'm like, no one wants to see me eat my chicken, but I am eating an apple, so I apologize. So.
Okay, that's okay.
So we're set to open, we were set to open next week already on Monday. And but unfortunately our air conditioning is out and won't be fixed before that. So that's pushing it back. We're requiring everybody to wear a mask that's in our building, but allowing, if somebody absolutely refuses, we're not going to make them, but they do need to stay 6 feet away from everybody around them. We're going to do mostly what we can for appointments only around rental assistance and try to minimize the traffic in our building. We're using another site, the Merrill Community Center, which is just a few blocks away from our admin office, and we're going to try to direct that traffic over there to just help to keep things separate. So we've had one staff member test positive for COVID, so we feel that it's narrowing in a little bit. Fortunately, she wasn't around anybody else. She was working remotely at the time, and so we're in the process of recruiting a fiscal manager, which just went out this week, but we know that's going to be a little challenging, not only the interviewing, but also with the training.
Yeah.
Nobody wants to sit, side by side. So we anticipate that we'll do that through virtual means, maybe through Teams. And some of our staff that can still work remotely, we're allowing them to do that. So our finance team, we're all working remotely through the end of June. And then only staff that need to be in the building will be in the building, and those staff will rotate. So when they can work at home, we'll have them at home, and only those in the building that need to be there.
Okay. Good. Thank you.
You're welcome.
So we have been closed to the public since mid-March. We do have some staff that occasionally go into the office observing social distancing. They have to wear masks in the office. We were originally talking about starting back up this week, but have decided to extend our close to the public until June 22nd. We are kind of watching what's going on in the county, the increases in cases, and we'll determine when we actually go back open to the public based on when we see a decline in cases. In Vernon County, we actually saw, I think, the highest day on Saturday or something like that for diagnosis of cases. So we're watching that. We've got some protocols in place as far as we're kind of following in line with the Badger bounce back that Evers had put in place, making sure that there's a decrease in cases. Our weatherization crews actually did go back Tuesday. So they started in the field with PPE for individuals that wanted them in the agency. Prior to that, we kept them pretty busy with online trainings. We did have some remodeling in our corporate office that they were able to come in and do. So we were able to keep them pretty well occupied the whole time that they were off. As far as when we go back into place, we've got a whole open procedure that we're working on right now as management team. We've ordered sanitation stations. Masks will be required unless you've got the ability to close an office door and work alone. Communal spaces, they'll have to remain in masks. And of course, observing social distancing. And we do have some people that have some concerns about coming back into the office and transitioning into that office setting again. So we're making it very lax. They can request to continue working from home. Supervisors can work with their staff on that. It was a bit of a transition getting them from an office environment to working from home, and it took some transitioning there. So we know it's going to be a transition back. As far as recruitment, we had a couple of positions that we actually had just interviewed right before we closed down to the public. And so we did some virtual onboarding, which was a fun experience. We've had a couple of those doing virtual recruiting and virtual interviews. We currently have 2 crew members we're looking for because we need to expand our crew just because of need. And we are recruiting a finance clerk because we've had an uptick in programs. We actually launched a COVID finance program, financial assistance program, when everything broke out, and we actually kicked out, I think it was $200,000 in financial assistance out to people that were impacted by COVID in like a 4 to 6 week period. So we've actually had some new programs that have launched off of this. The RAP money obviously coming, will be looking, we just hired somebody for that. She'll be starting on Monday. And what is the other one? Oh, our clothing center clerk. We're trying to fill our clothing center clerk in our Prairie office. So everything's actually been running pretty steady for us. Telecommuting has been working really well. We haven't really had any issues, and everybody's been able to stay pretty busy. And we've thrown in some fun things for staff during the COVID crisis, like office pets and things like that. So we've had some fun stuff to kind of keep people's minds off of it, and focused on some fun things too.
Thank you, Courtney.
Yep.
Pam, how about you guys?
Well, oh, you there?
Yeah.
Okay. We actually came back to work on Tuesday in the office, the crews, everybody.
Okay.
It's been a little bit of challenge getting everything we needed, but we do all have our own offices. We have sanitizer stations, automatic hand washing stations, plenty of masks. We are seeing clients by appointment only. And we're only allowing one person in a waiting room. Everybody else basically has to wait outside till their appointment. We're not taking walk-ins. We're asking they call for an appointment. Doing the best we can. I thought we'd have issues getting the crews back to work. Everything's taking so much longer because all of their equipment has to be cleaned before and after entering every house. And there still are some challenges because we've figured out there are some things that can't be cleaned, like the 100 feet of hose that goes from the insulation machine. Yeah, so all you can do is, you can't clean that. So you can wipe down the outside. That's basically it. But we haven't had any issues with anybody not wanting us to come in. So I think we're doing okay. Knock on wood, no one's sick. We did buy the, I don't know what you call them. We take all your employees' temperatures.
Okay, yeah. Those
We
infrared.
bought, yeah, we have 2, but we actually ordered 10 more that aren't here yet. So every crew can have one on their truck.
Okay.
So I know some agencies are doing, having clients actually sign, but we found out from Cap Law it is legal to take their temperature. So I guess what's going to happen is the guys are going to take their own and the clients, and we can do that here too. We haven't really worked that all out yet. So that's about it. We haven't had anything to recruit for, so it's business as usual for us.
Okay. Thank you, Pam.
Yeah.
How about SDC?
Hi, it's Pam. Similar to most of you, we reopened on this past Tuesday. Just the office. We aren't seeing customers yet. We plan to reopen on Monday to the public. And, same thing with requiring masks. People were taking temperatures. We plan on taking temperatures. We have the requirement with, of course, the social distancing and using the cleaners and disinfectants and all of that, washing hands frequently, all of that information we have posted around the building and are reminding employees of that. Recruitment, Miko, do you want to?
Sure, I can take over for the recruitment part for SDC. We actually have 7 positions open right now. A case manager, we have 2 for a case manager opening. So recruitment is actually, we are getting tons of people applying and candidates. So our managers will have great candidates coming through and a lot of them coming through. So we're very hopeful that we'll be able to fill the positions that we have open. And at this time, we are just really trying to manage that expectation while we were out, because we were out from like towards the late March until we just opened back up. We did some virtual onboarding, and that actually went really well. We used Zoom and other ways to connect with our employees that we were onboarding to get them through the process of that. And I believe we have a couple of more positions that we just received. So we will be posting more positions this week. And I think this will probably be the most we've seen in a while outside of our VITA when we do our hiring for our VITA season.
Okay.
But it's going pretty well.
Thank you, SDC.
I can chime in just quickly. We have not determined a date yet to open our offices to the public. We've been working, some of us are working in the office on a limited basis. Our offices are conducive to that. There's a lot of space, and so we can maintain good social distancing. But the majority of our staff are at home working remotely, and so we were able to move through that transition pretty good. Not that it was easy. Weatherization, we're looking at starting operations on Monday. So 6/1 is kind of what we're doing. The crews have a number of mitigating steps that they're going to take, assessments and things of that nature, so that we can make it safe as possible, just like y'all had talked about. The other unique thing that we've done is we've continued to operate one of our child care centers through the whole crisis. We have been really working hard to make childcare available to some of those essential folks who need to be in the medical areas or provide some online frontline services. So we've been doing that. The max has been 40 kiddos. What we've been doing though is a lot of, they put some really good steps in place to keep the distance when parents drop off their children for services. They don't come in the classroom, they don't come in any common spaces. Staff does take temperatures for themselves and complete a quick little assessment, but it seems to be really working, and in all honesty, the staff there have been very cooperative and exciting about helping out in their own parts during the time when people need them the most.
Thank you, Richard. I think we're last. Is that correct, Cassidy? I think it's just WISCAP.
Yeah, I think so.
So we were open, prior to this week, very limited, most staff working remote. However, out of our main office, we did have some rotational schedules and some people in the office on a limited basis. We tried to keep it under 5, and we've opened that up to a few more now starting this week, and created our safe, we call it COVID-19 phase-in safe work plan. And we started that this week. So everyone's masked up in the office, except if they're in their private offices. Let's see what else. We're not taking temps at this time. Our weatherization program just started back this week. They're transitioning back, so they're starting with auditing staff, scheduling audits and such, and scheduling jobs this week. And crews were rotating in this week, getting some COVID training, and then they'll start transitioning back into production as soon as we get jobs lined up. And then let's see, what else can I say? We're not going to be opening up to the public. We don't anticipate that till mid-June or later. We're also looking at the data in our area, which is relatively low cases. However, we just want to see what happens now that the state's opened up. So we're just kind of taking it week by week and just looking at the effects in our area. And I think that's all I have to say. Lisa, anything else on our opening you'd like to add? Oh, maybe she's off. As far as recruitment, we just had limited recruitment. We did hire an electrician recently. And we're ready to make an offer for an admin assistant. Usually our admin assistant jobs, we get a pile of applications and we hardly, we had maybe a quarter of what we typically get. So that was a little concerning. And then now we're going to be posting a couple professional case manager positions. So it'll be interesting to see how that works out. All the recruitment's been virtual. And now that we're opening up a bit, we may do second interviews in-house at a social distance with masks, but it'll just depend. So, Lisa, is there anything else I'm forgetting?
I don't think so.
Okay.
Can I ask a question, Jess?
Yeah.
What's everybody doing with their break rooms? Or
Well, WISCAP anyways, our rule is everyone needs to be masks and at a social distance of at least 6 feet. So technically everyone's eating in their offices here at the main office. Which,
okay.
you know.
Yeah, we have, you know, a communal water cooler and a coffee pot and things like that. And I definitely, and we use reusable mugs and things that we just wash. So
Yeah.
I definitely want to go to disposable, but then I'm thinking, do we get rid of the communal coffee pot and try to get single use coffee pots for everybody's office, or
yeah,
get rid of the.
We're not doing coffee service at this time, so we're not. You know, we put all the coffee makers away, and people are bringing their own.
Well, and that's the other thing, just telling people they've got to bring their own in and do it that way.
In our phase and work plan too, at each site, we had to designate a couple people to routinely disinfect the office on a regular basis too. So going around and using our wipes and doing the handles on the our refrigerators and copier and all of that. We've been pretty fortunate. Most people are still working remote. So it's usually less than 10 people at our main office in our warehouse. So it's worked out so far. But
yeah. Well, and we're so small, obviously. And it's been 2 of us that have been coming into the office more, and then Brad bops in and out, and Cassidy has been working from home the whole time. So I'm just kind of cleaning and sanitizing when I need to, or, you know, on a daily, sometimes twice a day basis. But we might have to get more formal about how we do that when people come back into the office.
Yeah, we definitely added more restrictions now with our phase and work plan. So,
okay.
And I if anyone wants to see our written plan too, just let me know and I can email it to you. It's not perfect, but it's what we're using, and if that could be helpful to any agency, just to let me know. So.
Hey, Jessica. So SDC, we, of course, you guys know we have 2 main buildings, and then now we have some staff that do outreach, and so we have a couple of different sites. So we had to get very strategic about how to bring the agency back online, per se. Our nutritional services was still going on. VITA was still going on with a touchless type of process where people were putting things right through, right in this mailbox in the foyer with the locked door, and they'd have to put things in there and talking to people. But as we came back on, so we want to talk about the break room, that took a lot of thought. So we are actually listing that there's no congregating in the break room. We did remove all the coffee pots. We had a television in there. We turned it backwards. People should sit 1 person per table, clean and disinfect the area after they are done. Every hour, high touch points are being cleaned and disinfected in that area. Also the water coolers around, and we've asked people if they want coffee, they of course could bring that in as on an individual basis for themselves, bring your own coffee. But the other thing we did right before we went out was set up cleaning and disinfectant stations all around the buildings where there was cleaner and disinfectant. So at any point that an employee may feel like they need to clean their area, there's no barrier to them having access to a cleaner and disinfectant, which we believe helps people feel better about being back in the space, that I have access to whatever cleaning and disinfectant materials that I may need at any given time for my particular workspace. So we still have those being replenished. Of course, I'm HR, I'm not facilities, but I go around and I check all of those stations to make sure there's still things there. So we're all pitching in to help our facility folks as well on that. And extra sanitizer, whatever we have, we are putting it out. And our employees have been very grateful for having access to it without having to necessarily ask someone about it. But yeah, pretty much eating in your offices or your workspace, or you can go and sit at one table, eat, and then pretty much leave the cafe is what we're doing.
Thank you. How many employees do you have in each of your sites?
Ooh, okay. So I believe right now we're a little over 70 here at North Avenue, almost 20 at Tatonia, and we have one small site that has 2 people. They're still working remotely. They're the only folks who are still working remotely. Everyone else has come back into our office spaces.
Okay.
We have some construction though as well, but we've seen to have worked around that. And like HR, we're in a conference room right now. So we had to move out of our suite into the conference room, but looks like we're working around that. But right now, I think we are at about 100 employees right now, which is a nice amount for us.
Yeah. Okay. Thank you. And very helpful on the break room information too. Anyone else? The next agenda item would be to talk about the new COVID laws that have been put in place, in particular the extended family medical leave and sick pay laws. And just in general, if people want to share kind of how that's being administered in your organizations, if you guys have any questions on managing these new laws. And just, yeah. For us at WISCAP, we've had a couple employees utilize the paid sick leave and extended family medical leave, so we haven't had high usage. But that seemed to go pretty well with everything we had in place. So, but we're a smaller agency. We're about 72, 75 employees. So. And we've been able to pretty much keep everyone working. So it hasn't been a huge need. But anyone else?
We've just had one employee, the one I said that tested positive. So she went out on the emergency paid sick leave. And then I'm just wondering if anybody else applied for and received a PPP loan and are using that to pay wages while people are not working.
This is Deb at NewCap. We did apply for it and received it, so we're using it.
And we're using ours just where other funding sources won't pay. So for instance, our daycare center and our homeless shelter, we're supplementing that with the PPP dollars. But like in the case of weatherization, they will pay. So we're using program funds in that case.
We had one person who utilized the extended FMLA, very minor. She lives on a farm, so when her husband was doing chores, she didn't have anybody to watch her kids because her daycares were closed. We also applied for a PPP for our boutique because obviously it's not open for the public right now for shopping. So We did get it just for that program. Otherwise, all of our other staff are still working. So it was just basically to cover those expenses for our boutique staff that also work in our food pantry, because the food pantry is open 5 days a week, but we can't have anybody in the store. So it was just to offset some of those expenses.
This is Pam at North Central Cap. We had staff and still have staff actually using the extended sick pay, not the FMLA, but the 80-hour sick pay in between working remotely and then the few hours that they didn't, have enough to do from home or whatever. So we'll be getting reimbursement for that, but we didn't need any other funding beyond that.
So yeah, we use the PPP to help us get us to where we are today, and we have had a lot of inquiries recently about the enhanced FMLA. In fact, we have about 275 employees, so the demand is becoming a little bit more pronounced. I think we have actually a half a dozen to maybe 8 or so individuals who are in the process of requesting and or actually utilizing the enhanced FMLA and or sick combination of. So it's been a different process to administer. We're following it just like we would any other FMLA request, following with some a request to documentation, et cetera, to kind of keep it consistent. But there still is a lot of confusion out there, because there's a lot of information that it's pretty fluid. And so we have to work through those obstacles, not only with those interested, but then also supervisors and staff trying to understand the dynamics and parameters of the program. So it's a good thing, but it's yet a little more complicated.
Mm-hmm. Yeah. Thank you. Anyone else?
This is Kathy at Southwest Cap, and we were able to keep everyone in pay status using one source or another. Most of our folks were able to work from home, but those that couldn't, we had funding sources available where we could keep them in pay status and didn't have to use any of the leave or lay anyone off. A few of our folks were in paid idle status, like the work crews, weatherization folks. They went back to work this week, just slowly moving into that with audits. And we did get a PPP loan. I'm trying to remember how much. I think it was about 120,000 off the top of my head. Don't quote me on that, but I think it was right around there. And we used that for folks that are typically paid out of funds that, all of a sudden the bottom dropped out. And that was mostly our thrift store revenues and our Lyft revenues. And so that was, extremely helpful to be able to keep those folks in pay status. Otherwise, we would have had people who would have probably gone off on one type of leave or another.
Well, if there's no other further comments, we can go on to comp adjustments. And Kathy, actually, I think Michelle had asked this of the group a while ago on hazard pay. So in regards to compensation in comping essential workers, has any of the organizations considered or have implemented a hazard pay with their workers?
We did at Community Action of Rock and Walworth. We implemented a $1 per hour increase, and we backdated that retroactively to March 23rd when we closed. And then that was given to those that were still working and still, so for instance, our daycare teachers who were still somewhat more at risk, and our homeless shelter employees, and anybody else, some of our caseworkers that were still having to see participants and have that contact, they all were eligible for it. But we're ending it as of tomorrow, with the anticipation of opening on Monday. So
Okay.
we really wrapped it around the time that we were closed.
Okay. Anyone else? And then how about wage adjustments for 2020 or 2021? Has your organizations reviewed your budgets and decided what kind of adjustments you'd make to pay scales this year or the next coming year or your fiscal year, however that falls?
Our board approves our budget in December. So in December, they already approved a 2% cost of living for 2020.
Okay.
We don't really expect any of the COVID-19 stuff to affect any of our budgets as far as wages.
Okay.
Our board also approved back in November for 2020, and we implemented a 2.5 merit or cost of living with up to 0.5% of merit, which will go into effect as of July. So we'll review then for the next year. We'll do that this fall. Well, actually late summer.
Okay.
We did a 2%, last year the budget was approved for a 2% COLA for 2020.
NewCap's budget was approved in November with a 3%, up to a 3% increase based on the employee's evaluation.
WISCAP, we're implementing a 3% starting our new fiscal year, July 1.
This is Pam at SDC. Our budget was approved back in December for 3%, up to a 3% for merit based on performance.
We got everyone? The next item is probably the toughest one the thing that I'm most concerned with is return to work accommodations. And for high risk individuals or those experiencing anxiety about returning to work. And so I just want to talk about that a little bit. And if you've already experienced that at WISCAP, I've just reached out to the program managers. Actually, today we had a program manager meeting, and for the programs that are opening up, like weatherization and a few others, if people are experiencing some anxiety or fear of returning to work, I've just asked those managers to let me know, just so we can kind of work through those accommodations, because some employees, if there's no telework option for our field staff, and so we want kind of like a soft touch for those that have those anxieties, and then we do have a handful of individuals that are high risk, and fortunately for most of those folks, they can work from home, so it works out at WISCAP, so it's not that big of a challenge. But I was just interested to hear how other organizations are going to be managing that, or if they've had some tough situations already with the accommodation.
So we're struggling a little bit. So we've asked everyone, from all the literature saying that, you can't, say, oh, you look like you have chronic kidney disease, you can't, we're asking people to and I'm not an HR person, so I'll make that joke, but, we're asking people to self-identify. But, it's rough because it's like we have some people that we know are of a certain age, have chronic health conditions, but they don't want any accommodations. They want to come in. And so then it's like, so we're just letting them do it and following the restrictions. But I mean, my concern is, I guess, so if we're doing that and they sign the policy, you know what I mean, saying, they agree to self-identify, blah, blah, and then they get sick, we're kind of legally okay, I guess, or?
Yeah.
Okay.
Yeah. Well, that's my understanding. CAPLA has been super helpful, and I don't know if everyone's been catching the CAPLA COVID trainings, but
They've been wonderful.
This last one in particular was so informative, and I do have a copy of it, so if any of you missed it, but they touched on this area, and it was very, very helpful on kind of the do's and don'ts. Because I would agree with you, Anna, that's kind of what we're experiencing too. We have a couple high risks that they can't wait to get back.
I mean, let's face it, I mean, a lot of us, our workforce is aging, and so, yeah, and with age comes other, comorbidities, disabilities, and people are just, they want to be out work, and it's, yeah.
Yeah. Anyone else?
We've pretty standard have in our policies already that if anybody has got any symptoms, they're not to be at the office. So if somebody comes into work and they're sniffling and sneezing, we send them home already. I mean, that was our policy before COVID, just simply because we've got some people that are really concerned about germ spreading. So we have our standard protocol already is if somebody comes into the office and they're showing symptoms of illness, even if it's allergies, go home and work from home, but don't be in the office. So we're going to continue with that process. We do also have a couple of people that are high risk, and they're aware of the risk, but they want to get back to work too. So we're doing the masks and the protocols of, making sure they're monitoring themselves, and we're offering up that ability to work from home still, even after we open the office back up, just to help people transition. We've had a couple people that have struggled with a little bit of the isolation. So we've really been pushing the EAP and really trying to stay and connect with those people that are struggling. Fortunately, the staff have been really good about reaching out to me if they've got issues. So we can kind of talk through things and get them connected with the EAP if that's what they need. But for the most part, with our crews going out, it's like most of them are going out even with suits, and making sure we've got the medical waste connection now, so that we can, because according to OSHA with the pandemic, everything has to be considered medical waste when it's coming back from people's homes, even if there's no exposure there. So we've taken a lot of precautions as far as that goes, making sure they're masked and their respirators are all functioning, and they've got suits and everything when they're going into homes. So far we haven't had a lot of people that have really put up any kind of a concern about coming back to work, as long as they have the ability to abide by the social distancing and the masks. It's been a pretty smooth transition so far at talking level.
Okay. Thank you, Courtney. Well, if no one else, my next agenda item is just, do any of you, have you implemented any wellness activities during this pandemic that may be helpful to others that we can copy? This is an area I'm horrible at. I feel like when this hit, it was like, holy moly, I could barely figure out all these new laws and create new policies. The last thing on my mind was any fun activities or anything that would be helpful or healthy for our staff, besides setting safety protocol in place. But have you guys done anything?
So one thing that we've done is that we utilize Slack for nonprofits. Has anyone heard of that? Slack is a communication tool, and it's been awesome. So just Google it. It's free for nonprofits. It's secure. So you set up, it's SLACK. You set up different channels. So there's like we would put all of our COVID information on there, and then just like general things. And then we have like a random fun thing. Like we're like, okay, show us, your dogs, show us your work from home spaces, do little polls and contests. And then for certain staff, it's been great. Like our homeless staff, they're really communicating because we've got people. So we've got about 170 employees, in 4 counties. everybody's, remote mostly. And so having this has really been helpful. And it's free for nonprofits up to, I think, 250 users, but even then they were waiving that at some point over that due to COVID, but it's been wonderful.
Oh,
And you can put little people are sharing recipes and pictures of their babies and you know what I mean? It's really it's been nice. It's been really nice. So for example, our server went out last week and no one's at the office. So here I am at home. I have 4 kids and I'm yelling at my kids to stop streaming because I think that that's what's going on and I can't use, you know what I mean? The internet's not working. Well, so Becky, our benefits manager, immediately puts a thing on Slack saying our server's down, Clearwater has been called, you know what I mean? And so it just get out to everyone. Otherwise it would just be, I would have got like 40 texts, it would have been ridiculous. So, but it's been really nice to keep, to keep together, and then we're serious stuff. So we're, updated guidelines from Mayo, you know what I mean? Updated all the office things, public health warnings, those things. Our new policies, but then we're doing like the fun stuff too. So it's been nice.
Thanks, Anna.
Yeah.
NewCap has a wellness program that we utilize all year round. And we added an additional challenge, if you will, that was geared around having to stay home. And if you participated in the challenge, you were given an extra 200 points for participating in the challenge. And it was more than just being active. You had to eat right, exercise, get the right amount of sleep, drink enough water. We encouraged everybody to drink half the amount of ounces in your weight. So if you weigh 160 pounds, you had to drink 80 ounces of water a day. And then encouraged everyone to do a little bit of reflection as well. And I just made up a simple Excel spreadsheet with the dates and all of those things that I just mentioned. And all they had to do was check that, yes, they did it at some point during the day, then uploaded it into our wellness program. And they'll get the 200 points at the end of the challenge, which was the end of April. So in the way our wellness program works is if you hit the top level at the end of our benefit year, you get a $100 gift card, Visa gift card. And we also open that up not only to our staff that are on our insurance, but all staff and their spouses, whether they're on our insurance or not, can participate in it because we want everybody to be healthy. And so it's an incentive for them. And we've been doing this for about 3 years. And we've had great response to it.
So that is a program through your health provider?
No, it's actually the wellness program itself started through our insurance agent, the agency.
Okay.
Provides the wellness program and the setup for it.
Thank you.
Uh-huh.
This is Candy. The other thing that we have done is on a Friday afternoon, because our offices officially close at noon every Friday, is we've had a virtual yoga class online where we can all log on and we have an instructor lead us through that. And then we have like a little socialization half an hour after that, so we can just gab and kind of get to see faces again and relax. So we've done that a few times as well, which has been a great way to reconnect now that we're all working virtually yet.
And this doesn't have anything to do with wellness. However, on Thursdays from 4 to 5, anybody that wants to, through Teams, we do this. Anybody that wants to join, we have what we call a happy hour. So we have a glass of wine with each other via Teams or an old fashioned or whatever we want, and we just really visit for that hour.
I love that.
We had a actual wellness bingo that had been rolled out shortly before we shut down. So it was actually geared up so that you could do things at home too. Everything from drinking enough water to getting out and walking, or no pop, or trying meditation or yoga or something new. Cleaning your workspace. So it was nice to have that going. We also did a your favorite pet with captions and had a contest going where our board actually got presented the results and voted on the cutest submission for pets. We've also had some creativity amongst our teams when they've done their team collaborative meetings where they actually came to their virtual meetings dressed up in costumes. So they kind of, every branch of the organization kind of took a little different spin on it. And kind of did their own thing. We also had an organization locally that did fundraising for us they've been doing it every Monday pretty regularly throughout this, where they do a virtual trivia night. And a lot of our staff log in and participate with that and have some fun. And then the proceeds go to our organization then as a fundraising option. So we had a few different things that were going on that were a lot of fun.
Yeah, that's cool. Anyone else? Thank you for sharing. And then lastly, just how do you feel your organization may change in the future, and how you work within your organization may change in the future? And I'll start out at WISCAP. Who knows, but we, it'll be interesting to look at our program outcomes during this time. Our ops team have had some discussions on this, just to kind of see, how we do and if we can keep up. Teleworking seems to be working out better than I anticipated. It was quite a challenge to set up initially and get everyone the proper equipment. We're very rural in our 7 counties, and so internet has been somewhat of an issue for some, but I think we've worked out most of the kinks. But yeah, I don't know what's to come. I know this is going to be the way we're going to kind of work for the rest of the summer, I think, and into the fall, as far as part telework, part in the office. But I don't know after that how it will change, the facilities that we own, rent, all of it. It's kind of mind-blowing to think about how it could all change, really. Any of you?
I just feel like it, where there's so many nevers. Like 2 months ago, did I ever think I'd be wearing masks everywhere and like ordering all these different ones on Etsy? Never in a million years. We've even gone to now, we feel like this might be for the long term. Until there's a vaccine or effective treatment, this could go on for years. We think that it's, we might be at work for a little while, then home. We've changed our policies that you can't buy all-in-one computers anymore. You have to buy laptops. That's been a huge problem. Getting our finance staff the ability to remote into our accounting system, do those things where we had finance staff that said that they could never work from home, now have been, had been working from home for 8 weeks. We have some staff that may stay remote for the foreseeable future.
Yeah. Well, and just changing the way we process documents
as
an organization. We haven't really implemented any official electronic signature system at WISCAP, and so now we need to look at that. I'm looking at online benefit enrollment would be nice. So, those sort of electronic changes that, and we don't have on-site IT, we contract it. So, and it's very expensive. So luckily Lisa and I take the lead on IT stuff for WISCAP, and it keeps us very busy during COVID. But yeah, so we just got to take time to kind of research these things. So what else has everyone been doing to make things a little bit more efficient for their organizations?
We too have found that working remotely has worked out really well for a lot of us, and that's why we're willing to still allow that to keep people safe and to make them feel like they're safe as well. We're going forward, we're going to look at pushing whatever we can to the cloud. So for right now, our accounting software is installed locally on our machines. We need to look at payroll. We use Paychecks.
Yeah.
But so we're looking at both of those together. We want to get electronic timesheets. All of this has just reinforced the need that we need to do that soon. And what we have really isn't working well.
We have electronic timesheets through Paychecks, and it works great.
You
We
do?
had that. We had that before, but yeah, we could talk offline sometime.
Okay.
It's
Yeah.
you know, it was a little bit of an adjustment getting it, you know, to figure out with our, because we don't have just one pot of PTO, but I mean, it's worked well. I mean, we are very lucky that we had this in place before COVID happened.
And are you on Flex or are you on just the regular?
We're on Flex. Yep.
Okay. Yeah, we need to talk offline.
Yep.
So,
Sure.
Okay.
For our agency, we actually offered telecommuting before COVID. So we were kind of ahead of the curve on that. Some of our staff have set days during the week that they work remotely. We have some staff that they predominantly work remotely. So fortunately, we didn't have to worry about that too much. Most of all of our staff, when we order computers, we already order laptops. So again, we were kind of ahead of that. We had a couple of staff that didn't have internet connections, but we provided them with hotspots through Verizon. So that was pretty easy to do. As far as moving forward, we again had a lot of our stuff electronically. We have electronic timesheets. When I started at the agency a couple of years ago, I was surprised to see how much actual physical paper documentation there was and not a lot of electronic documentation. So that was something I really pushed for when I first started here. And we've transitioned quite a bit over. And I'm very pleased to see now that some of the things like with the state for weatherization is transitioning over to electronic, where they've always been very much of a pushback to paper. So I think that'll be nice. We'll be transitioning pretty much predominantly to electronic going forward. We already use a cloud-based SharePoint system for a lot of our documents, so it's accessible for anybody anywhere. Our accounting software is, they can log in remotely to that as well. We are actually upgrading that hopefully this year, and that will be strictly cloud-based going forward. Other than that, I think everything else is, I mean, we're again, like I said, we're pretty much ahead of the curve on that. It wasn't too much of a transition. It was more finding out what we were going to do to keep those people who don't generally work remotely busy. That was where our first focus was when all of this broke out, and the safety procedures we needed to get put in place.
Sure.
So I guess moving forward for us, it's just going to be continuing down that track of making sure that everything's electronic and accessible, and status quo, because who knows how long this is going to last. Every time I talk to somebody new, there's a different timeline in place.
Yeah.
This is Kathy at Southwest Cap, and I think one of the biggest changes that we have yet to wrap our minds around is in the area of volunteers. We rely so heavily on volunteers for our food pantries and for our thrift stores, among other things, but those are the two biggies. And obviously the bulk of them are in the high risk category, and many of them will just simply not be coming back. So our stores are shuttered, and we don't know. We don't have even a tentative date of when we're going to get them back open, because we just simply don't have the bodies right now. And so that's going to be a huge shift that we're going to have to figure out how to crack that nut. We have a lot of, one thing that COVID did is really raise the level of awareness of, sort of the breadth of what we do, and kind of connected all of those parts. People know of the food pantries, or they, know of the WIC program, or, it's always or, but now it seems to be and, where they seem to see the breadth of what Southwest Cap does. And we have a lot of champions out there, and we have a lot of people who really have been incredibly supportive. Whether or not we can convert that into a volunteer base that will replace our, the hardest working generation ever. I don't know. I don't think so. We don't see volunteers like that in our young folks or people my age. And so that's really going to be something we're going to have to figure out. It's going to be a tough thing for us.
Mm-hmm.
I just one little other thing. I think it's like some of you have mentioned the need to work remote or to utilize technology and communication has been almost forced upon us, and it's been a good thing. I don't know if it's a silver lining in the cloud, but it certainly has required us to look at technology. We're struggling, as an example, with Google Hangouts and what are the limitations with and without that. And so you look at other opportunities like Zoom or some other platform. That's just one example of what I think will help us change, the face of what the agency does and how it delivers its services. But I also think it helps us adapt to some of the demographics of the workforce that is looking for some of these opportunities. Instead of having to come to an office on a 9-to-5 basis and in the traditional sense, it's allowed us to be a little more flexible. Now we have to define what that looks like in the future, but I think it's at least an opportunity, albeit forced, for us to take a look at that. So that's good.
Well, thanks everybody for meeting. If there's nothing more, that about wraps it up for our roundtable. Unless anyone else has anything else they'd like to ask the group. Well, thanks Cassidy and Diana for getting us together.
Yep, no problem.
Appreciate it.
Thank you for facilitating this.
Yeah, no problem. And yeah, again, if anyone needs a copy of any policies or safe work COVID plans, certainly reach out to each other, our group, and we can share what we have. But other than that, that's all I had. Thank you.
Thank you.
Thank you.
Yep, bye.
Bye-bye.
Thanks a lot.